All right, it looks like we have everyone. Thank you so much for joining us today for our media availability. Today, we're going to be talking about flu and COVID-19. My name is Heidi Bosk, and I will be your moderator. First, we'll start with the presentation, and then we will end with our Q&A. So if you could hold your questions until the end, that's great. And I'm going to take us over to our presenters. So our participants for today, we have Dr. Eric France, Chief Medical Officer for CDPHE. We have Dr. Sean O'Leary, Professor of Pediatrics, University of Colorado Anschutz Medical Campus, Children's Hospital, Colorado, and Heather Roth, Immunization Branch Chief, Division of Disease Control and Public Health Response for CDPHE. And we're going to start with Dr. France.
Thanks, Heidi, and thanks for all of you for joining us today. Today, October 1st, if you look out my window, I see the beautiful colors of fall beginning. And it's certainly a time of year where we start thinking about the respiratory season and its impacts on our communities. Every year, our doctors and nurses and clinics and hospitals really have to ramp up starting in October because of all the different viruses that we'll be confronted with. And of course, a big one is influenza or the flu. It kills tens of thousands of Americans every year. More than 3,500 Coloradans were hospitalized just this last year. And the flu season is a bit like almost like the hurricane season, respiratory season in general over the winter months is usually a series of bad illnesses caused by viruses. And we know as doctors that once one of these viruses is in our community, we're going to get pretty darn busy taking care of patients in the clinic and admitting people to hospitals. There are times, just like with hurricanes, where you can have more than one storm happening at the same time, and we'll have serious respiratory viruses hit us at once. And during those days, we're working long days, we're sending people to the hospital. Hospitals go on diversion because there's just too many beds being filled. And it's really hard, not only for the healthcare providers, but for the community that's sick, the people who miss work, who have to stay home to take care of kids. So having two respiratory viruses hit us at the same time, like two hurricanes hitting us at the same time, is a big deal. So not surprisingly, we're thinking a lot about that when it comes to this upcoming respiratory season, where we know we may have COVID-19 respiratory illness and flu illness hitting us at the same time. Next slide, please. Now, imagine not only the difficulty of being sick with both viruses at the same time, but just getting a respiratory illness this time of year, trying to say, do I have COVID? Do I have flu? We'll have to test you to really understand if that's the case. And if we have both of these respiratory viruses hitting us, it's clear that our teams, our doctors, our nurses, our clinics, our hospitals, our nursing homes are going to be potentially overwhelmed by the dual impact of these two infections at the same time. So it's important, though, that we do have this opportunity, and this is certainly where you guys come in. We need to get the word out to be sure that we prevent influenza illness, because we have effective vaccines, and we'll be promoting the vaccines this year. We don't, of course, expect our COVID vaccine in the fall, and so we're really looking to improving immunization rates on influenza as a way to manage during a time of a double whammy of two terrible respiratory viruses happening at the same time. It's important that we emphasize that vaccination is key so that we don't overwhelm our hospitals, and of course, so that we don't spread this flu virus to those we love. It's one thing if I get sick and have to spend 3 days in bed with the flu because I didn't get vaccinated, but it's another if I give it to my child with asthma or my mother-in-law who's 90 and ends up in the hospital. The flu vaccine works, it's very safe and effective, and it will be a key component of our COVID work, preparing for the COVID season by being sure we're vaccinating everybody with the flu. Next slide. And Sean, I'm going to turn it over to you here.
Yeah, hello everyone. This is Sean O'Leary. So I just want to point out, it's every year we do recommend that all persons aged 6 months and older get an influenza vaccine. There are certain higher risk groups that it's especially important for, but we really recommend it for everyone. I want to take just a moment here, though, to address a specific concern to this year, and that's around SARS-CoV-2, COVID-19. Some of you may have heard that there was a lot less influenza circulating in the Southern Hemisphere this past season, and are suggesting that that may be predictive of what we see here in the US this year. While I think we all certainly hope we have a mild influenza season, I think there were a lot of differences that were happening then in the Southern Hemisphere than what we may expect here in the US. For example, when the data when the data came out from the Southern Hemisphere, that was at a time of very extraordinary mitigation measures with significant lockdowns in many of the countries in the Southern Hemisphere, and the things that are essentially not going on in the US now. We're already seeing increasing cases of SARS-CoV-2 in many states around the US, including Colorado. And so I think we cannot expect that we're not going to have a flu season here. It is especially important this year, as Dr. France said, to get your flu vaccine. The other piece of that is a lot of those Southern Hemisphere countries had very high flu vaccination rates. So that also probably played a role in their lower transmission status. Next slide. With this slide, I just want to highlight a couple of the benefits of vaccination. There's a lot of misinformation that circulates about flu vaccine every year. One being that it's not very effective. The effectiveness does vary from year to year, but in fact, even in years where it's deemed not as effective, it in fact does have a lot of benefits. These studies are in children. The one on the left is regarding intensive care unit admission. Children who are vaccinated have a dramatically decreased risk of ICU admission. And then on the right, you can see there's also a dramatically decreased risk of death in children. Every year we see several hundred deaths in children from influenza, and influenza vaccination is the best thing we have to prevent that from happening. Next slide. And with this slide, I just want to point out that coverage estimates vary by age for flu vaccines. So children tend to have higher flu vaccination coverage than adults. We do have some room for improvement there. Among children 6 months to 17 years, about 71% were vaccinated. Certainly this year, we would love to see that number get a lot higher. But for persons 18 and older, the uptake is about 51%. And we, of course, would like to see that much, much higher this year because of the potential intersection of COVID-19 and influenza that Dr. France discussed. And also to point out that Colorado, we are doing a bit better than the national average, but we still have a lot of room for improvement. And go ahead and go to the next slide.
Great. And now I believe we're going to take it over to Heather Roth.
Thank you. Hi, everyone. So I just want to talk a little bit about what the delivery of flu vaccine will look like this season. It's going to be a season unlike any other. Vaccination is going to take a variety of forms. These could be drive-through, drive-up, curbside, walk-through, parking lot clinics, in addition to the more traditional healthcare settings. The Centers for Disease Control and Prevention issued pretty substantial guidance for healthcare providers to help them plan to provide influenza vaccination in a variety of settings and make it safe to do so. So no matter what form a flu clinic takes, it does require additional considerations during the pandemic. And this includes mask wearing, physical distancing, personal protective equipment, and enhanced sanitation efforts. I will say that the department has also created an off-site clinic playbook that we've shared broadly with healthcare providers as well to help them think through all the considerations about safely hosting flu clinics this year. Vaccinefinder.org is a link that is on the slide here. It's a website that is developed in collaboration with the CDC. It allows healthcare facilities to upload information about their clinic operating hours, insurance sources accepted, and types of flu vaccine that they have on hand. That's something that anyone with internet access can access. You can do it on your computer, you can do it on your mobile device, and you can find a clinic near you. Flu vaccine is free for those with Medicare, Medicaid, CHIP Plus, and most other insurance plans at participating providers. Next slide, please. I wanted to talk a little bit about how flu distribution works. So healthcare facilities obtain privately purchased flu vaccines directly from manufacturers or third-party distributors. The department also pre-books publicly funded flu vaccines every year in January for the following flu season. And then these flu vaccines get shipped directly to healthcare facilities throughout the season. We knew that this season was probably going to be, again, unlike any other in the past. So we actually have an increased supply of both adult and pediatric formulations of flu doses this year. We typically receive approximately 5,000 publicly funded flu doses from CDC to cover uninsured and underinsured adults in Colorado. This year, we've secured an additional 293,600 publicly funded flu doses, again, to meet that uninsured and underinsured adult population in Colorado. And we secured these additional flu doses in an effort to meet the anticipated increased demand this fall, especially given the increase in and underinsured patients as a result of the pandemic due to rising unemployment rates and the resulting loss of employer-provided health insurance. And then we again secured an additional 35,300 publicly funded pediatric flu doses and added to our normal size of about 278,000 doses for pediatric patients. And those pediatric patients would be served by providers enrolled in our Vaccines for Children's program. It's a federal entitlement program. These would cover kids who are uninsured, underinsured, on Medicaid or Medicaid eligible, and then American Indian or Alaskan Native. That's it for me.
Great, thank you all so much. Now we'll go ahead and take it over to our Q&A portion. I would say before I kind of get into the nuts and bolts, I know most of you have done this before, but if you have any questions that are different than the topic we've discussed today, please feel free to send those to media_info@state.co.us. And now if you have a question, you can go ahead and use the raise hand function at the bottom of your screen, and I will call on you. It would be wonderful if you could say your name and the outlet you're with before you start. Great. Meg, we'll start with you.
Hello, this is Meg Wingeter from the Denver Post. There have been some concerns about, individual pharmacies and offices and such running short, but is there any concern about having enough vaccines to cover not only all the high-risk people who probably get it every year, but also the entire public, as you're asking people to do?
So this is Heather. I think I can take that one. I have not heard directly from pharmacies about flu shortages or private healthcare providers. And I don't actually have any concern right now with our supply levels. We're actively seeking to enroll providers to give these flu doses to those adults who qualify. So I don't have a concern with our supply.
And historically, I'd say by October, by this time of year, we would be hearing from manufacturers if they were having trouble producing the vaccine, we'd know that we would have these delays. And I haven't heard of any to date. So expect the supply should be good.
And this is Dr. Leary. I will also add that nationally, the manufacturers are producing more doses this year than in prior years.
Great, thank you. Now let's go ahead, Marianne, I'm going to go ahead and take it over to you.
Hi, this is Marianne Goodland with Colorado Politics. I have two questions. First, with regard to the publicly funded doses for the uninsured and underinsured, and for the pediatric, how do they get that if they're not on Medicaid or CHIP or some of these other publicly funded programs? And my second question is, can you address another virus that seems to be fairly prevalent this time of year at nursing homes, and that's Norovirus? How do people protect themselves from that?
So I will take the first question. This is Heather. For the pediatric patient population, there are very strictly defined eligibility criteria for publicly funded doses through the Vaccines for Children program. So the child would have to be uninsured, underinsured, which means their plan just doesn't cover routine immunizations. American Indian, Alaskan Native, and then either on Medicaid or eligible for Medicaid. For the adult population, it's a little different. Those publicly funded doses are really for adults 19 years of age and older who are uninsured or underinsured, again, covered by some sort of plan that doesn't routinely cover flu vaccination.
But how do people get these? How do people get these? Where do they go? How do they find out about this, other than through us?
So the publicly funded doses are distributed through our Vaccines for Children's programs. We have 550 different provider offices across the state that provide these vaccines to their patient populations. It wasn't in the slide, but we also have a map on our webpage that actually lists all of these different providers that are enrolled in this program.
And what about for the adults? How do they find out about this? How do they get these?
That map includes both pediatric and adult providers.
Okay. And then about Noro?
So if you let me just to add to that, fluvaxcolorado.org, FLUVAX Colorado.org is the website that specifically provides information about flu shots and as well as where you can go to get them. And I think you're probably aware Norovirus is a virus, a seasonal virus. It is a virus that causes vomiting and diarrhea, and it lasts a few days with cramping and fever and can be spread through any place that's enclosed, like a nursing home or a military base or a cruise ship. And so there are outbreaks that occur, and good hand hygiene, good cleaning off of surfaces, and our traditional infection control practices is how we make sure that outbreaks are not spreading wherever they may happen.
Thank you.
Great, thank you. Taylor, I'm going to go ahead and take it over to you.
Hi, thank you. Taylor Summers for NBC News Radio. I was wondering if you could elaborate on efforts, more targeted efforts to potentially vaccinate children, even through schools. I remember a couple months ago when we talked about this subject, one of the things that stuck out to me, I believe it was Dr. France who said that children are potentially some of the best vectors for the flu virus every fall.
I'll start with that one, and then maybe Heather or Eric, if you want to tackle more about schools. So pediatricians' offices and family medicine offices vaccinate children for influenza every year, and so they often have extra influenza vaccination clinics, whether that's extended hours or weekend hours or walk-in clinics. This year, with the COVID-19 pandemic, practices are getting very creative in their ways of delivering vaccines, including influenza vaccines. So some are even doing it in parking lots. Many of them are still doing it within the clinic, but with extensive safety measures in place to make certain people are wearing masks and are distancing from one another, et cetera. So lots of options within primary care clinics. In terms of schools, those efforts vary year to year in places that have school-based health centers. For example, within the Denver Public Schools, there's an extensive system of school-based health centers. They're often able to deliver influenza vaccine. This year, it's going to vary. It's probably the school-located influenza vaccination is probably going to be a little bit different because of the fact that a lot of schools are not open for in-person learning. But my understanding is that there will be some delivery within schools, and I'll see if Dr. France or Heather have anything to add.
This is Heather. I will add that in conversations with the Colorado Association of School-Based Health Centers just yesterday, they mentioned that they had held 2 separate school-based health clinics for flu vaccination, and they have 2 more planned within the next few weeks.
I have nothing to add.
Great, thank you. Amy, I'm going to go ahead and take it over to you.
Oh, there we go. Okay. Yeah, I just had 2 questions. The first, I know we're not in the thick of flu season yet, but I was curious if you have any numbers as to cases that we've seen so far in Colorado, maybe compared to last year. Are we seeing less with, obviously all the extra safety precautions? And then just my other question is, you mentioned earlier that clinics may need to re-examine how they are giving these flu vaccines with maybe sites, outside. What exactly could that look like? Maybe tents like we saw with coronavirus testing. Can you go into that at all as to what that may look like?
I'd be happy to start. Regarding the question about whether we've seen some flu cases in Colorado and what does that look like, every year we do see cases that are happening across the summer months. We tend to think of this as only a winter virus, and certainly in the form of a pandemic where it goes through a community, that's what we experience in the winter. But there are always some cases that are happening over the summer. We consider them background cases, and they don't necessarily predict anything about what our future flu season will look like. I have not looked at what our case rates have been. Oftentimes the flu you see in the summer might be somebody who's returned from the Southern Hemisphere after a vacation, or maybe they were on a cruise and they bring it back. And so there are these isolated illnesses for the most part. It's rare and very uncommon that you'd see any spread of flu in June, July, August. We'll start to get cases, and the question then is, when is it going to arrive? There have been a rare November pandemic, or epidemic, I should say, of influenza. I think 2003, 2004, it hit hard in November and was gone by the end of December. It typically is more of a December, January, February, but then again, even late, sometimes into April. So we never really know what it's going to look like in terms of when it arrives, how long it will be here, and of course, how severe it is. Which means for planning purposes, the best we can do is be sure that folks get their flu shots and practice good hand washing and other respiratory hygiene. The question about how we might vaccinate people, it's true that there's a lot of experience in Colorado over the years of doing mass vaccinations for flu, and local public health agencies have helped run those. Some large healthcare delivery organizations have done those outside tents. Sometimes they may have a drive-through flu shot, or they may have people appropriately distanced in line getting shots. It depends on the weather, but we're fortunate that October is often sunny weather, allowing for those kinds of settings. We're really encouraging people to get their shots now. October, November is the prime time for it. And so finding a place on fluvaxcolorado.org for your shot and getting it done in the next 2 weeks would be my recommendation.
Great, thanks.
Wonderful. Do we have any other questions before we send you about your merry ways today? Great. Dr. France, Dr. O'Leary, or Heather, do you have any final thoughts before we close out?
Again, my thanks to all of you for promoting the important message that it's time to check off the flu shot on your to-do lists. A large number of Coloradans have been getting their flu shots over the years, and I'm hopeful that those who have not will step up in order to protect the people they love, as well as to reduce the burden of work on our healthcare providers. The month of October is prime season for flu shots, and please get out there and take care of this item off and check it off your to-do list.
Right. I think that about covers it for me. I think if there's 1 year to get your flu shot, if you haven't gotten it in prior years, this is the year to get it.
I agree, and I just want to reemphasize that healthcare providers and pharmacies, retail locations, they are all making sure that it is safe for you to get your flu shot. A lot of things have been put into place to make it safe to do that. Safe to leave your house, safe to get a flu shot.
Great. Thank you, everyone. Thank you for joining us today.